Hey guys, Dr. Brian Kinslow here from Evolve Flagstaff. We're showing today a sciatic nerve mobilization or glider. So oftentimes patients with different conditions can feel what we call nerve tension. So they oftentimes feel this need to stretch the hamstring muscle. They might have back pain or another condition, but stretching can make it worse or doesn't relieve symptoms, or that sensation of needing to stretch comes back. So we often find what we call nerve tension, and we can relieve that not by stretching, but by gliding the nerve up and down. So it's important in this exercise that you should not feel any symptoms. The trick is that you shouldn't feel like much is going on at all, because if you are feeling symptoms or a feeling of tightness, you might be stretching or tensioning that nerve, and that can be very provocative. That can make your pain worse. So what we're going to do is we're going to stand and hold on to something for balance. We're going to bring the hip up in a little bit of flexion, and then we're going to pull the toes back and up, the whole ankle, into what we call dorsiflexion, and we're going to straighten the knee and point the toes. We're going to come back, straighten the knee, point the whole foot, pull it back as we bend. And we want to do this in a rhythmic way, back and forth, for about 60 seconds, potentially up to 2 minutes. Okay? And then, should retest, you should feel some of those symptoms start to dissipate a little bit. Okay? So why this works is that the hamstring starts here and ends down here. So a lot of times people go to stretch and they're really pulling their toes back and they feel this tension right back here, thinking it's a hamstring stretch. But if I ask them to point their toes, that symptom goes away. So the hamstring ends right here, and the ankle muscles have nothing to do with the hamstring. So moving the ankle around without changing knee position doesn't affect the hamstring at all. So when we bring on a stretch and then it's reduced with pointing the toes, that's actually tensioning on that nerve, and that's what we want to work on in this exercise. We want to do the opposite and glide it up and down rather than stretching on it. Another version, sitting down, is we do the same thing. We're going to sit nice and tall with a good posture. We're going to pull the toes back here, and then we're going to point the foot at the end. If you do it the opposite way, pulling the toes back at the top, show from the side, we'll often feel tension or even pain there. So we want to go there, pointing the ankle, and then rhythmically coming back and forth, up and down. 1 to 2 minutes when you're feeling those symptoms, or at least once a day if indicated in your PT program.